Hi, I'm Isaac, and today I'm talking about my research project that I was a part of this semester in this class called Sleep Health Awareness and the Detrimental Effects of Inadequate Sleep. Sydney Bradford, Camille Dayton, Isaac Triance as me, and Amber Vernon were all members of this project. In essence, we wanted to determine the public's knowledge of sleep and also the detrimental effects that can happen upon a person in relation to inadequate sleep. Inadequate sleep is basically constituted as anything under 7 to 9 hours in adults, basically starting at the age of 18, all the way until you hit an older adult level, which is about the age of 50 to 60. We decided to kind of modify our age range and parameters to a window of 20 and 40-year-olds, and we reached out to these people via a Sleep Health Awareness Survey, or SHAS for short. In essence, we asked 4 questions. We had 4 questions that we based our research on. We had way more than 4 questions in the survey. But these questions were how aware people were of what constitutes inadequate sleep, to what extent are people aware of the signs and symptoms of common sleep disorders, as well as how aware people are of the connections between inadequate sleep and cognitive function, as well as cardiopulmonary and pathophysiological diseases and their associated negative outcomes related to inadequate sleep. We also wanted to know how aware individuals were of the prevalence of sleep disorders and pathophysiological disease, cardiopulmonary disease, and cognitive diseases. These all kind of helped us gauge and create a survey that was very comprehensive, and we got a lot of cool results from. Today I'm going to kind of focus on some of the stuff that I found interesting in our results. Today I'm going to be talking a little bit more about how we understood the population's, viewpoints in relation to metabolic homeostasis, along with associated disorders and diseases. We wanted to understand how well people were aware of sleep being a leading cause to some of these major disorders. So, in a result, we actually had a lot of people respond to our survey, 298. And that was amazing. We were not expecting that many people. However, 81 of those people actually ended up not completing the survey fully or fell out of our age range of 20 and 40-year-olds. So we cut back down the responses and collaborated our data around 217 usable completions. We had a general, good responses within age groups. People from 20 to 29-year-olds, we had about 51% of those as respondents, and people from 30 and 40, we had about 49% of those as respondents. We found out that a lot of people, male and female, ended up actually responding at about the same rates in terms of their understanding of disorders related to sleep. We also found out an interesting correlation with the spread of people's understandings in accordance to their educational rating, or I should say attainment. Those with higher degrees of education or levels of education typically all answered about the same in respect to associated disorders and diseases related to sleep health. Out of male and females, we had respondents show essentially the same levels as I said before, and we found out that not many people really understood at lower levels of education anything about circadian rhythm disorders, and even lower levels, even among those people within the higher level of education, didn't really understand what chronic fatigue syndrome was. So those were some interesting things to highlight about our research. We basically came to the conclusion that the people who took this survey, though they had a general understanding of sleep disorders, could improve on their understanding and action in terms of having comprehensive interventions created in order to help them get more sleep. earlier on in the study, most people reported actually getting inadequate sleep. So we want to kind of reach out to the public health community and to increase efforts in spreading awareness of the detrimental influence that inadequate sleep can have on the overall health and well-being of individuals. As various programs and interventions are created to help eliminate this issue, there will be an overall increase in health for everyone. Thank you so much for listening to my summary of our pretty awesome research project this semester. I hope to talk to you guys soon in the discussion panel, and we'll keep on going. Good luck with the end of the semester, guys, and enjoy your summer break. Have a good day. Bye-bye.